ඒකයි බය නැතුව මම Nokia Android smartphone එක ඕන කෙනෙකුට ගන්න කියන්නේ.
සමගා අලුත් වන Nokia.
Biosamples of 56 people who had been in direct contact with a woman infected with COVID-19 detected from the Bandaranaike Mawatha in Keselwatta were sent for PCR testing yesterday. Accordingly, their reports were released this afternoon. Following a study of the reports, the area public health inspector revealed that 12 of them had contracted the virus. Also, a resident of the same area who was hospitalized last afternoon has also been infected. Meanwhile, an expectant mother also from the same area was hospitalized last night after she had started to bleed. Upon examinations, it was determined that she is COVID-19 positive. Altogether, 15 cases of COVID-19 have been reported from the area of Keselwatta. In the meantime, with the detection of 15 fresh coronavirus cases today, the total number of infections in the country increased to 269. Meanwhile, yesterday, 6 COVID-19 positive cases were detected from the Valisara Quarantine Centre, while 3 were identified from the Oluville facility. One individual was detected from the area of Varakapola. According to Commander of the Army Lieutenant General Shavindra Silva, all of them were detected while being in the quarantine process. Meanwhile, the individual detected from the Varakapola is a 44-year-old woman undergoing self-quarantine. She had moved from Rambukkana to her brother's residence in Tulhiriya, Varakapola, around 3 months ago. She is employed by a cleaning company and was deployed at the Katunayaka International Airport. The health department had instructed her to self-quarantine after being exposed to another staff member who tested positive for COVID-19. She had channeled a doctor at a private medical centre in Tulhiriya on the 7th or on a near date after catching a cold and developing a fever. While being under self-quarantine, she received the results of her first PCR test performed, which concluded that she is COVID-19 negative. However, another test performed 10 days later had determined that she is COVID-19 positive. Accordingly, she was transferred to the Infectious Diseases Hospital yesterday by health authorities. Meanwhile, the 6 cases of COVID-19 infection detected from the Valisara quarantine facility are found to have had direct contacts with a COVID-19 patient in Suduvalla of Jayala. They are residents of Colombo 10, 12 and 13. Elsewhere, a man admitted to the Chillout General Hospital on suspicion of contracting the virus had attempted to escape. Upon scrutinizing his history, authorities found that he is a severe drug addict who had contact with the quarantined group of Nagalagam Vedya in Colombo. He was captured by the police along with the public health inspectors and sent back to the hospital. Meanwhile, biosamples were obtained from colleagues of the husband of the COVID-19 patient in Keselwatta for a PCR testing. On a very encouraging note, 10 more COVID-19 patients were given the go-ahead to leave the hospital today following full recoveries. This increases the total number of recoveries in the island to 96, while placing the number of active cases at 166. This pushes the country's recovery rate to 35.68. It is a 1% better than yesterday's figure of 34.6%. 122 people, however, are still under medical observation.